Pompe disease is a rare, inherited neuromuscular disease that disrupts normal functioning of the heart and skeletal muscles. This disease affects 1 in every 40,000 children. Symptoms appear within the first few months after birth. Infants will experience muscle weakness and poor muscle tone. This results in the baby being unable to gain weight and grow at the expected rate. Tests typically show an enlarged liver and heart, as well as heart defects, and babies will often experience breathing problems. Once diagnosed, if untreated, the baby will only live for the first year of life. Symptoms appear by the age of 1 and result in progressive muscle weakness, delayed motor skills, and serious breathing problems. The child's heart may be abnormally large, however, they typically do not experience heart failure. Once diagnosed, the typical outlook for survival is until mid-childhood. Symptoms appear in late childhood, adolescence, or adulthood. This is typically a milder form of the disease and less likely to involve the heart. However, progressive muscle weakness will impair the functioning in everyday life and may lead to respiratory failure. A child must inherit the mutated recessive gene from both parents in order to develop Pompe disease. The gene is responsible for production of an enzyme called acid alpha glucosidase, or GAA. Researchers have detected 300 different mutations in the GAA gene that can cause the symptoms of Pompe disease. The mutation causes the deficiency in the GAA enzyme that is normally responsible for breaking down glycogen for energy in the muscle cells. Because of this mutation, glycogen accumulates inside the cell lysosomes. Without the ability to properly use the glycogen, muscle movements are then compromised. While there is no cure for Pompe, there are treatments that help. Individuals are treated by a team of specialists, which include cardiologists, dietitians, physiotherapists, and occupational therapists, which only offer symptomatic care and support. There is little research as to the effects of exercise and nutrition on improvements to Pompe disease. However, typical medical practice used to subside late-onset symptoms of Pompe disease include gentle daily stretching, the use of splints and/or orthotic interventions, and providing postural support and corrections. Therapists use general precautions taken in other degenerative muscle diseases when conducting strength training for individuals with Pompe. Cardiovascular programs may be implemented with clearance from a pulmonary specialist and have been shown to improve aerobic capacity and motor function. There is new research surrounding diaphragm pacing systems for individuals restricted to a ventilator. Michael Stanzoin was the first individual to receive this medical treatment for Pompe disease. This system is a battery-powered breathing device that frees individuals to lead a more normal life. This allows individuals to receive home care and improves their functioning in daily life. Enzyme replacement therapy, also known as ERT, has shown inconclusive results for treatment of late-onset Pompe disease. However, with recent research, enzyme replacement therapy has been determined an effective treatment for infants and children. In trials with infants, enzyme replacement therapy has proven to reduce heart size, maintain normal heart functioning, improve muscle function, tone, and strength, and has an overall reduction in glycogen accumulation. 2 drugs have been approved for treatment by the FDA, Myozyme and Lumizyme. Although these drugs have shown to be beneficial, research has also proven that patients taking ERT may build up a tolerance to the GAA enzyme due to the production of antibodies, which ultimately reduces the effectiveness of the treatment. Future research should surround developing a method to combat the production of the antibodies so the enzyme replacement will remain effective. There is also a need to investigate alternatives to enzyme replacement therapy and the role of exercise for the treatment of Pompe. An emerging study that has not yet been approved by the FDA for treatment of Pompe is called chaperone therapy, which is described as the use of chaperone molecules that assist in the stability and functionality of mutated enzymes. This is supposed to be particularly beneficial because it does not replace the enzymes, but rather improves the current deformation. John Crowley went through extraordinary measures in hopes of finding a treatment for his 2 children with Pompe. Because of his efforts, these advancements in medical technology could not have been possible.
With the right business plan, I can also promise you a working enzyme for Pompe disease. I can't cure your kids, you know that. They're always going to be in wheelchairs, but I think I can save their lives.
That's a clip from the new movie Extraordinary Measures. It's based on a couple's efforts to find a cure for their children's genetic disorder, Pompe disease.
The movie is striking a chord with a local family who is all too familiar with that rare disease. News Channel 15's Alyssa Ivinson joins us now with the story of a local girl beating the odds.
Well, you may remember Mallory Gross from the MDA telethons here on Wayne TV. She's been the ambassador several times. When Mallory was diagnosed with Pompe disease, doctors told her parents she'd only live to be 7, but now they're saying to save for college. Mallory Gross loves to sing. Music is the 4th grader's favorite subject. Like most other 10-and-a-half-year-olds, she likes video games.
Turn this on.
She loves hot pink and being goofy. Mallory wants to be a veterinarian because she loves animals.
Especially horses, dogs, cat, animals, except mad animals like hyenas.
All things doctors didn't think would be possible when she was a baby. At 18 months old, Mallory was diagnosed with Pompe disease, a rare genetic disorder that stops the body from making an enzyme to break down sugars. Without that enzyme, sugars build up in the body and can stop muscles from working. But as a toddler, Mallory joined a clinical trial for a new treatment. It saved her life.
She helped get it approved by the FDA because her test results were so, amazing.
She gets transfusions of the missing enzyme every other week through an implanted port.
And I hooked up and then my nurse played a needle with me until I get my needle out.
Rumor has it Mallory's pretty good at Monopoly. Now, a story similar to Mallory's is in the theater. The movie Extraordinary Measures shows the struggles of a family with 2 children with Pompe disease.
It hit home. I mean, everything that those kids went through, oh my gosh, that's what Mallory went through.
A movie like this is important just for maybe contributions to the MDA. People can see it and be more aware.
The Grosses also hope the movie will inspire people to donate for more research